Thanks, Diana. All right, I think we have critical mass, so we're going to go ahead and get started. For those who joined late, hi and welcome. My name is Kristen Burnett. I'm the Deputy Director for Sehat Initiative at Public Health Institute. I use she, her pronouns. And we're going to go ahead and get started to tell you guys all about the RFA and answer any questions you may have. Next slide, please. Thanks all. So over the course of the presentation today, we're going to talk about an introduction to the project, share an overview of the key project elements, discuss reporting requirements, as well as the required application documents to submit, as well as have some time for Q&A. We envision this webinar to be mainly information for prospective applicants about the two funding sources, ARSI, S2S and URSI. We will have an accompanying webinar next week that will go more into detail about the actual application process, that walks through some details around the SurveyMonkey Apply platform that we will be using to collect your application documents, as well as go into more detail about any questions you may have about the attachments that you will be submitting. So if you have questions that are very specific and technical about the application process, that will be covered next week on the 25th. And please reach out if you did not receive an invite or have questions about how to register for that webinar. Next slide, please. And here's a list of our wonderful presenters from Sehat Initiative today. I'm not going to read all of these names out loud, but just be aware we have a great team here to support you. And we will introduce ourselves as we each speak throughout the presentation. And next, I will pass it over to our program director, Dr. Siddiq.
Thank you, Kristen. Hello, everybody. My name is Siddiq. I'm a program director with Sehat Initiative, a program of Public Health and Institute. Our portfolio is largely focused on immigrants and refugees. I also want to appreciate for all of you being with us on this call and your interest in the proposal and also serving our community. I promise I'll be quick so that we can have more room for you to ask questions. I would like to go quickly through some background challenges, significance of this funding, and also the primary goals that we want to achieve, all of us want to achieve through this funding. First thing first, why is this funding even here? And the purpose, the main reason for this funding is based on the very huge and significant refugee admission and arrival in the United States, close to almost 500,000 people, 400,000, and there are still refugees being admitted, some 100,000 plus from Afghanistan, 270,000 from Ukraine, and only two countries, almost 400,000 refugees admitted to the United States. However, in the past, pre-COVID, the average refugee admission to the United States was from 200 plus countries, around 25,000 people. In fact, during the COVID in 2020, the refugee admission dropped to around 13,000 people. So imagine 13,000 people from 200 countries, but now we have almost 500,000 people from only two countries in this short window of time. So the number of refugee admission is significant. Now, speaking of our target population in this grant, the children, that is significant as well. For Afghans, 50% of the admission are children or school-age children. And for Ukrainians, 90% of them are women and children As you might be aware, men are not allowed to leave Ukraine because of the laws there to fight against the Russian invasion. So a large portion of the admission are children, and also in so many ways, schools are considered safety islands because these children are new to this country, they're alien to the community, and also even at home, they are facing challenges because their parents might be struggling with adjustment and starting a new life here. So schools are really important for not only academic success, but their health and well-being of these children, and also successful integration in the community. And last but not least, these children are coming from a context that back home they have different curriculum and higher illiteracy rate. And especially in the case of Afghan refugees, those refugees who are coming from rural areas due to insecurity, due to lack of roads, lack of schools, lack of teachers. For some children, this might be even first time they sit on a chair in school. So that's why all of us are jointly facing a complex challenge to make these kids successful in a school setting. Next slide, please. So with all the challenges mentioned, the aim of this project is the ARSI Supported School and URSI is to support not only the academic performance, but also the successful integration of these children in the community. And funds are generally aimed to provide linguistically and culturally responsive services, also considering because of the hardships and trauma that is associated with displacement, that the funds are intended to prevent acceleration of trauma or re-traumatization, because the integration process itself is traumatizing and hard for so many children. So while doing so, considering the prevention of re-traumatization in these children, it's also important to prevent secondary and vicarious trauma in those who are in contact with these children and families, to prevent burnout in teachers, school counselors, CBOs, and all those who are involved in providing services to these families. And generally, this funding is intended to prioritize communities that are underserved, hard to reach, and low income. That's why in the proposal, you might see that we are requesting zip codes to be included as well. Next slide, please. So PHI and Sehat Initiative or program encourage partnerships, collaborations, collaborative proposals, and joint regional initiatives. Why is that the case? Because the needs of the refugees are multifaceted, multi-layered, and they don't need one thing. And they need housing, they need navigation, they need referral, and they need social needs, medical needs, mental health needs, and employment, so on and so forth. And sometimes when we are in contact with our refugees, we ask them, what do you need? And the answer we get is that, what do you have? Because some of them come here, end up here in this country, not even having a backpack. So that's why their needs are diverse, and those needs are best met when there is a joint effort between multiple parties. And also seeing this grant from a refugee perspective. If we are a refugee, for us, we will be on a vigilant status because we are displaced. That is how a human body reacts to adversity and displacement. It is hard for them to deal with 10 different parties, and every time they go there, they provide documentation, signature, address, and all the supporting documentation that is required. It is hard for them. That discourages refugees from seeking support, and it is recommended that there is a continuity of support services to refugees through a partnership and collaboration, and the services are uniformly provided. And last but not least, partnerships are inherently it involves knowledge transfer, capacity building, and especially because of the fact that refugees and immigrants are coming from different contexts, and often services are provided in compartments through ECBOs, ethnic-based community-based organizations. And when there is partnerships, that is in the best interest of the not only us, but also the community that we intend to support. So with that, I will hand it over to Allison.
Thank you so much. Hi, I'm Allison. I'm a project coordinator with Public Health Institute Sehat initiative, and I'll be talking a little bit about the Afghan program, ARSI S2S, and the eligibility criteria for this program and documentation requirements. So like many other programs, there's pretty specific criteria for who's eligible to participate and the documentation that will be required to be reviewed and collected. So just to give a little bit of an overview, ARSI is focused on school-age children and their parents. So for school age, that's folks who are entering school in preschool or pre-kindergarten through the age of 18. And then folks who are over 18 are eligible if they are enrolled in high school or a GED program. And then next, I'll kind of walk through a few of the different populations and the eligibility that we need to pay attention to. So to start off, Afghan humanitarian parolees are eligible for this program. If they're a principal applicant, their eligibility start date would begin July 31st, 2021 and go through September 30th, 2023. And then there are a couple of other groups in that humanitarian parolee category who have eligibility beyond September 30th. And so that's going to include a spouse or a child of an individual described in Section 1, and also a parent or legal guardian of an individual described in Section 1 who's determined to be an unaccompanied child. And so again, their eligibility date extends beyond that September 30th date. And then as far as the end of their eligibility for services in this program, it's going to be March 31st, 2023, or the end of their parole term, whichever is later. So obviously March has passed, but if they have an extended parole or re-parole, that's going to continue to make them eligible for this program. And then additionally, if they gain another OR eligible status, so like if they apply for asylum and are granted asylum, that would extend their eligibility end date. Next slide, please. OR eligible Afghan refugees are also able to participate in this program if they've arrived after July 31st, 2021. Their eligibility begins on their date of arrival, which is noted on their I-94 document, and it extends for 5 years after that date of arrival. And again, for folks granted asylum, if they were granted after July 31st, 2021, they are eligible. Their eligibility start date begins on the date of asylum and extends for 5 years. And obviously, there's a lot of information about eligibility dates and deadlines. So the policy letters from Office of Refugee Resettlement are referenced here. And you can also find more information on the ORR eligibility guide. Again, we'll be sending all this information out, so you don't have to commit it all to memory. Next slide, please. And then this slide goes over some of the acceptable documentation that you can use to verify eligibility. You will be responsible for reviewing and maintaining a copy of this eligibility documentation. So for Afghan special immigrant parolees, you can look at documents such as the I-94 or employment authorization document to verify eligibility. For Afghan special immigrant conditional permanent residents, documents such as the passport, the green card, or the employment authorization document with specific codes stamped will be things that you can check to verify eligibility. Next slide, please. For Afghan humanitarian parolees, the I-94, a passport, or employment authorization document are acceptable. And then for Afghan special immigrant, you can look at the green card, the employment authorization document, or a passport with specific stamps. And so again, this information is detailed in the Office of Refugee Resettlement Policy Letters. We will send this information out, and I'll also link in the chat the documentation guide, which walks through appropriate documents for verifying eligibility. And now I'll pass it over to my colleague Irina to talk about eligibility and documentation for URSI.
Thank you, Alison, and hello, everyone. My name is Irina Osaicha, and I'm a refugee health navigator. Today, I will give details about eligibility and documentation for Ukrainian Refugee School Impact students and URSI students service focus on eligibility for Ukrainian and non-Ukrainian children and their families who was displaced from Ukraine. And eligibility individuals start from birth until the age of 18. And population which covered by this program, it's a four main category. First one, it's a citizen or nationals of Ukraine who has parole into United States after February 24, 2022 up to September 30, 2023. Second category of eligible students, it's non-Ukrainian individual who had a residence in Ukraine and has parole into United States the same day as February 24, 2022 and up to September 2023. Third category, it's covered by individuals, spouse, children, and family members who came after September 13, 2023, if they have someone who came earlier in section first and second group of population. And fourth category, it's a refugee who came after September 13, 2023, and its parents or legal guardian or primary caregiving of refugee or minor or child described in section 1 and 2. And please check the policy letter and the end of the slides for more details from Office of Refugee Resettlement. And on next slides, we will learn more about acceptable documentation. Immigration status and category of applicants, it should be specific and follows criteria. As we see on a slide, we have three main category of applicants. First, it's Ukrainian citizen and national who receive a humanitarian parole, also known as Ukrainian humanitarian parole or UHP. Acceptable documentation you can see on the right slide of deck. It's mostly documentation about I-94 employment authorization or passports. And second category, it's non-Ukrainian individual who receive a stamp of U4U program or UHP program and who was displaced from Ukraine. They can submit following documents which you see on the slide. And third category, it's non-Ukrainian individual who had a residence in Ukraine, but they don't have a United for Ukraine program or UHP, but they have to provide a proof of residence in Ukraine. And now I will be passing it to my colleague, Ezra.
Thank you so much, Irina. Hi, everyone. My name is Ezra. I'm a project manager with Sehat initiative, and I will address the key project elements. So there are 5 key elements for this project, and these include connections for basic needs support, family engagement and empowerment, youth engagement and development, school enrollment support, and building the capacity of service providers. Priority funding is allocated to local education agencies and community-based organizations throughout California with a high influx of eligible Afghan and Ukrainian youth and families. Next slide, please. One of the key allowable activities include connecting families with resources and services to address critical basic needs, such as food, housing, and healthcare. Please pay attention to some of the distinctions between URSI and ARSI S2S examples, which we color-coded in this slide for you. These are all examples, but not a comprehensive list. Next slide, please. Another key allowable activity includes family engagement and empowerment. The goal of this activity is to integrate parents into the school community and equip them with the resources, information, and capacity to partner with the schools in supporting their children's education. Here are some examples of activities associated with with family engagement and empowerment, but you may have other qualifying activities as well. Next slide, please. Youth engagement and development. The goal of this activity is to support academic, linguistic, and socio-emotional growth of students and build pathways to post-secondary success. Again, these are all examples, but not a comprehensive list. Next slide, please. School enrollment support. The goal of this activity is to support timely school enrollment and reduce cultural and linguistic barriers to learning for students. Several examples of school enrollment activities are shown in this slide. Okay, so then I will hand it over to my colleague Sarah to discuss about the fifth allowable activity.
Thank you, Ezra. Hi, everyone. My name is Sarah Lackey. I use she, her pronouns, and I'm the Advisory Group Associate here at PHI Sehat Initiative. The fifth allowable activity is service provider capacity support, with its goal being to develop and coordinate a community of practice to foster the sharing of information, best practices, and lessons learned. And here are some examples. Again, like the other activities, these are there. You could have more that qualify. And we also wanted to let you know that building community of practice is one of the main goals of the project. So in an effort to support this, we have created an advisory group to foster communication and collaboration among LEAs, CBOs, and other individuals who are committed to this project. And I will share more information about this on the next slide. You could go to the next slide, please. Thank you. So far, we've had 3 communities of practice advisory group meetings with attendees coming from LEAs, CBOs, PHI, and CDSS. In those meetings, we've discussed common challenges from attendees who are beginning to implement RFA, S2S, and URSI services, or have experience working with Afghan and Ukrainian refugee students and families. Some of those challenges include eligibility documentation verification, transportation, or a need for more support staff. We've also focused on discussing ideas to mitigate challenges based on what other attendees have done, like connecting families who live near each other and have the same or similar cultures so they can support each other with childcare or transportation, and also using family engagement coordinators to facilitate and support family engagement at schools, or also supporting with eligibility documentation verification. Based on the survey results from our initial 2 meetings, the most pressing needs of the Afghan and Ukrainian communities are more focused on basic needs and family engagement and empowerment. However, these are solely observational based on those first 2 meetings, and we understand this may not fully represent the needs of the community. We will continue to have virtual meetings for our advisory group. Right now, those meetings occur on a monthly basis, and we're excited to continue to provide informational presentations, opportunities for discussion and collaboration, and avenues for attendees to connect with new or familiar colleagues throughout our meetings. Our next meeting is actually this Thursday, and we'll be focusing on basic needs support. So if you're interested in attending the meeting and learning more about our advisory group, in the chat, I'll share our webpage link so you can sign up, and our email so you can reach out if you have additional questions. And I will now pass it to my colleague, Donia, who will discuss reporting.
Thank you so much, Sarah. I'm Donia, and I'm the Monitoring and Evaluation Associate at Sehat, and I'll be walking us through the key reporting requirements for the programs. So firstly, all awardees are responsible for verifying the eligibility of each client served in the RCS, S2S, and URSI programs. Participant eligibility is outlined in detail in the policy letters as shown in the slide here, and we will be emailing the slides after the webinar so you can access all of these links. More specifically, during the duration of the funding period. So technically from now until the end of June 2026, and for 3 years after the project ends, it will be your responsibility to keep secure records of eligibility files for each student that you serve. And then lastly, we just wanted to share that we are currently in the process of finalizing performance measures. These are measures that we will be using to measure progress towards outcomes and results for the 2 programs, and we will be sharing them with you all soon. Next slide, please. So next, I'll just continuing in the reporting requirements, we will be asking all of you to collect data for every single service that your district or CBO provides and to complete quarterly, semi-annual, and ad hoc reports. For the quarterly progress reports, it's important to note that submission and approval of these reports is required for invoice payments to be processed, so it is vital to follow the submission dates to avoid delays. Semi-annual metric reports will be required to track and report on metrics that are applicable to the services being provided to PHI through on a semi-annual basis. And these are an integral part of the state's ability to meet RCS, S2S, and URSI reporting requirements. And then lastly, we may receive requests from CDSS for the submission of ad hoc reports throughout the year. If requested, we will provide as much notice as possible, but we recognize that the turnaround timeline for submission may be short. And then lastly, I just wanted to quickly give an idea of the types of quantitative and qualitative metrics that we will be requiring all awardees to track. This isn't a comprehensive list, but some metrics may include the number of unduplicated eligible refugee participants categorized by gender, grade level, and months since arrival to the US, the number of times that the service was offered in the reporting period, as well as the frequency of the service offered, the number of eligible students who participated in services and were successfully promoted to the next grade level, and then lastly, also challenges that were faced during the reporting period and success stories. And now I will be passing it on to my colleague, Jasmine.
Thank you, Donia. Hi, everyone. My name is Jasmine Kukan, and I am the Student Wellness Advisor with Sehat Initiative. I'm going to be going over some of the required application documents. So these include the project abstract and cover page, the project narrative, work plan, budget, and budget narrative. I also want to mention that the submission deadline for the application is on May 1st. However, we are offering an extension for those who request it to May 15th, and you can email refugeeschoolimpact@phi.org to submit that request. Next slide, please. So the project abstract and cover page should be 1 page maximum and submitted as a Word or PDF document. This page should include the project title, the organization name and website, and point of contact for the proposal, target populations, titles, and credentials of staff providing services to students and their families, the requested award amount, the number of unduplicated eligible individuals who will be served, and a brief description of the intervention model. Next slide, please. And the project narrative should be no more than 6 pages and should also be submitted as a Word or PDF document. This narrative should provide a clear description of how you propose to meet the project activities and also specify the proposed target population, location, activities, and project approach. Please also outline your organization's expertise in serving the academic and social needs of school-age populations and refugees, the strategy for reducing the challenges these populations face in accessing services, and how the organization plans to assess for eligibility. Now I'll hand it over to my colleague, Sarah, to discuss the work plan.
Thank you, Jasmine. Again, I'm Sarah, the Advisory Group Associate. I'm going to be talking to you about the work plan. A work plan will need to be submitted using the PHI provided Word template. We have separate templates for RCS, S2S, and URSI. So if you're applying to both funds, then please make sure you submit separate work plans for each. This is a 3-year federal award. However, year 1 is almost complete. So you will need to complete and submit the work plan template that details your planned activities for only years 2 and 3 of the project. So your first year of the project will technically be the second year of the federal award from the Office of Refugee Resettlement. And the next two slides, I'll provide more information on how to complete the work plan. If you can go to the next slide, please. Thank you. So the first part of the work plan has a table like this one, where you'll record the number of clients you intend to serve for each of the 5 categories. The year 1 column says NA, because as I mentioned, it's not applicable as we're only doing funding for years 2 and 3. Before filling this out, you should refer to the eligibility tables for RC, S2S, and URSI, depending on which one you're applying to, for more detailed client eligibility to make sure your number of eligible clients served is accurate. And then each table has a row for each type of activity. Please make sure that you're providing client numbers for each type of activity you're planning for. And then also for capacity building, as you see, the number of participants should include teachers, staff, volunteers, and maybe a few student or family leaders, depending on the activity. And for the other 4 activities, you need to distinguish between the number of eligible students and the number of family members, with the total column being the total number of unduplicated clients, not the sum of years 2 and 3. If you can go to the next slide, please. Thank you. And the next part of the work plan is the planned activities table, where you'll describe all of the work that you're going to do. And you can refer to this table in your project narrative. And you can be more specific about the activities you have planned in this section. And please make sure you can add rows if you'd like, if you have more activities than the 3 rows provided, or delete rows if you have less than 3. You'll need to record the timeline and frequency of each activity. You'll need to record who will be served. And this is where you'll indicate if it'll be eligible students, family members, and/or staff that you're serving. You'll also need to record how many individuals you expect will receive the service, as well as any performance measures you'll use to evaluate how successful this activity will be. That could be the number of sessions or the number of services provided, and others as well. And then in the last column, you'll need to indicate who's responsible for carrying through that activity. This could be an internal staff from your organization, or if you're working in partnerships and you have subcontracts or plan to issue subcontracts, you'll need to indicate here if a subcontracting organization is responsible for that activity. All right, next I will pass it to my colleague Susan, who will discuss the budget.
Thank you, Sarah. Hi, I'm Susan Gluhenish, the Program Administrator with Sehat Initiative. This slide provides some basic guidance on the Excel template in the RFA. As you've already heard, while there is a year 1 of our award, as Sarah mentioned, your application will be based on what's considered years 2 and 3, and we've included the dates of those timelines. The template needs to be completed along with an itemized budget for each lower tiers for your organization, along with each lower tier that you intend to contract with. This Excel template needs to be completed and should include your indirect cost, either using your NICRA, your negotiated indirect cost rate agreement, if you have one, or you can apply the de minimis rate of 10%. Any subawards that you intend to issue, the IDC rate is listed separate, as you are capped at the first 25,000 of each subaward. And on this slide, we've also included, for reference, some unallowable expenses that cannot be on the budget. Next slide, please. Okay, so along with that is a Word document, a budget narrative that has to be provided along with the budget to describe how the requested funds will be expended. If you're applying to both RC school to school and URSI funds, submit a separate budget narrative and template for each. Each budget narrative should include detail on the role of each staff listed on the project budget and the percent of time, effort level on the budget. And also how you've come to the costs of how non-personnel budget items, the costs were determined. And we'll also need a breakdown of the subcontract budget amounts if you intend on contracting with a lower tier sub. Next slide, please. If you could provide the following documentation as a separate attachment with your application, the 501c3, your proof of nonprofit status. If you are selected, you will be required to submit a copy of your NICRA, your negotiated indirect cost rate agreement, or if you do not have a NICRA, you can apply the de minimis rate of 10%. School districts will use the approved rates from the California Department of Education. And now I'm going to pass it on to my colleague, Kristen.
Thank you, Susan. So I wanted to touch base a little bit about the scoring criteria for applicants that we will use. So we are expecting that our applicant grantees will demonstrate existing infrastructure and the ability to provide culturally and linguistically appropriate academic or support services for these students and their families. We are also looking for applicants to demonstrate that they have a plan to identify eligible students and their families and collect the required documentation for the students that is required by the Office of Refugee Resettlement. And we are scoring by criteria that fall into the following 4 category domains. The first being organizational capacity, which would be, does your organization have experience working on similar projects? We want to learn about your staffing structure and the expertise within your organization. Your project approach is really going to be included in your narrative as well as your work plan. What are the activities? What is the need for those activities? How are those activities decided upon? What are the actual interventions that you seek to provide to the students and families? And what is the projected impact of those activities in serving the needs of the communities? The other one is financial viability. This will be your budget, a detailed budget with justification for what you are requesting in terms of your dollar amounts, as well as some background on how your organization is structured to maintain efficient use of these funds. And the last is demonstrated community need. Please tell us about the communities that you serve, where they're located. That's why we ask a question in SurveyMonkey Apply about the zip codes, communities, schools, school districts, where you're serving. If you have multiple sites, please provide additional detail there and share with us what you've learned about these communities. It could be statistics that you share from external sources or needs assessments that you've done internally. And as mentioned in the chat and as mentioned throughout in the presentation, we are going to hold a second webinar next week on April 25th from 1:30 to 2:30 Pacific time, where we can answer more questions and share more about the SurveyMonkey Apply platform and go into more detail if you have questions about the specific documents that we covered quickly today, such as the project narrative, the budget narrative, etc. You can register in advance using the link here. The link has also been shared in the chat. Next slide, please. And we are ready to answer your questions. I know we have many in the chat, which we will get to. And if you ever have questions, please reach out to us at refugeeschoolimpact@phi.org. We have an entire team ready to assist you. So please feel free to reach out anytime. And with that, we will now take questions. So feel free to raise your hand or come off mute if you would like to ask a question. I'm seeing in the chat a question about the negotiated indirect cost rate agreement and when it is used. Susan, can you provide more detail about the NICRA?
Sure. Organizations have a NICRA when they do business with the federal government, and PHI has a negotiated indirect cost rate from our main funder, which is HHS. So larger or even small, if you do business with the federal government, you may apply for the NICRA, and you'll have this rate that's given to you that's good for a period of time, and then you have to reapply. If you don't have a NICRA, then you can use the de minimis rate, which is 10%.
Thank you. I see another question in the chat about whether we're able to charge for snacks. The answer is yes, you are able to provide food and refreshments for activities as part of this grant. What you are not able to charge is for delivery services, so no DoorDash or Instacart. Susan, please let me know if you have anything to add to that.
No, that's correct. You could provide food for evening activities, after school events.
Thank you, Susan. Katharina, I'm seeing a question about for activities, do we need to select activities for each of the 5 areas, or can we focus completely on one? We leave that up to your discretion. It really depends on the budget amount that you're requesting and what the needs are in your community. So you do not necessarily have to pick to provide activities that fall into all 5 categories. We do highly encourage participation in our communities of practice advisory group for capacity building, as well as to budget to participate in our conference when we bring everyone together who is working on these activities, which will be in Sacramento in the fall, and we will have one other annual conference after that. I see a question from Danielle. Can services be just for parents, or do they need to be for students and parents? They can be just for parents, as long as it is a parent of an eligible student that falls into the eligibility that we covered for ARSI, S2S, and URSI previously. This eligibility is also summarized in eligibility tables that are part of the application documents. There may be family engagement or parental engagement activities where the student is not present, and that is okay. I see another question. Do nonprofit applicants have to have an agreement with school districts and or work with districts for this grant? Not necessarily. They can apply on their own. However, we do want your focus to be on these students. So it may make sense to work with the districts, but we leave that up to your discretion how and what that looks like. You don't necessarily have to be in a formal agreement. Just making sure I'm getting all the questions that were in the chat. I think the last one is the per student allocated budget for 2000. Is that for one year period or for 2 years? I encourage you to look at our FAQs we've had quite a bit of questions about that 2000 per student guidance. That is really just guidance. We understand that, and that's for the entire project period, which is 2 years. It really depends on the service that you're providing. There may be some services that you're providing that are very brief, one-time things that would be, and a student or a family member could participate in a one-time event that would not be $2,000 in cost. And there could be some that are much more costly because someone's participating in weekly sessions, for example. The idea is to give you a guidepost around as you're designing your budgets. It is not a prescriptive rule that every student or family member must fall into exactly $2,000 per participant. It's really intended as guidance. I'm seeing here another question. Would parolees who have had their parole status expire and are currently applying for asylum but not yet granted ineligible be under this funding, be ineligible under this funding? I'm going to pass that question over to Allison.
Yeah, so this is a little bit complex. So for folks applying for re-parole, if they applied, then before their status expired, then it doesn't, they have continued eligibility. If they have an expired status, I think I would need to review the eligibility guidelines for Afghans and Ukrainians because I think there's slight differences. But typically, if someone is an asylum seeker and they don't have an ORR eligible status that was listed, then they would not be eligible under this funding. If they've been granted asylum or they retain another ORR eligible status, then they would be eligible. But I can link out a couple of resources that, because there's some differences between Afghans and Ukrainians here, and there's just some various conditions. So tentatively, I would say if it's just that they have asylum seeking status, then no, but there may be exceptions.
Thank you, Allison. I see another question. What about people who switch their status from parolee to TPS? And this is for Ukrainian population.
I can answer this question, Lika. Hi. I wanted to say that Ukrainians who will switch to TPS, unfortunately, they're not eligible for this program based on Office of Refugee Resettlement. So they can apply for re-parole, which recently announced in February. And after that, they can be a participant in this program. Otherwise, at TPS, it's not eligible.
Thank you, Irina. I saw a question about more service options that we can give to students and parents. So this is a very brief overview that we're going over today. There's a lot more detail of different suggestions, and not a full comprehensive list, but many more suggestions are contained in the RFA document, as well as the policy letters that are referred to within the RFA. So please take a look at those if you want more ideas of specific activities that you could provide under each of those 5 categories.
Kristen, I think we missed a question. There is a question about, can we put office rent in the budget?
Thank you. I'm going to defer to Susan on that.
I'm sorry. Did you say rent?
Yes,
Ezra?
can we put office rent in the budget?
Yes, if it's tied directly to the project, yes.
I'm seeing a lot of questions about eligibility, so I'm wondering, Diana, if we can back up to the ARSI eligibility table that's near the beginning of this webinar. And please, I encourage everyone to review the RFA document, which has eligibility tables at the very end in the appendix. In addition, the application documents that you download from SurveyMonkey Apply also has a handy table that summarizes eligibility information that we've synthesized from the policy letters provided by ORR. So please take a look at those as well. But here is a little bit more about the ARSI S2S eligibility. So as you can see, the eligibility start dates are in the middle column. And can we move forward one slide just to review this again? And skip ahead to the URSI eligibility. Thank you. So again, there's very specific eligibility dates for this funding. So it is very important to be very clear on who is eligible and who's not. You may be receiving funding from other programs that are similar, such as CalNew, Refugee School Impact, ARSI. Every one of those programs provides similar services, but for slightly different populations with different eligibility. So please be sure to review these documents to ensure that you're including the eligible population. Thanks, Diana, for scooting back to that.
Kristen, there was another question in the chat. Can the population be in both AHP and in this grant?
Thanks, Troy. Sorry, I missed that. Can you say what AHP stands for? Or does it?
It's the Afghan Health Promotion, but I would want to confirm.
Is Troy still on the call? Afghan health promotion through RHPP. Does anyone know the answer to that? I'm not as familiar with the eligibility. Okay, we will look into that. I will look into that for you, Troy, but my suspicion is that yes, as long as the services are not duplicating between the two programs and you're providing unique services that are true to the goals of this grant to the same person, that they would most likely be eligible for both. But we'll look into that more. And that's actually really true of any of the funding that you might be receiving from different sources, whether it's RSI, HP, the ARSI program, CalNew programs. There's many that serve the same population, and the idea is that what you're providing through each is a different service, so it's supplementing, not supplanting one another. So you'll want to outline that in your application as well if you're receiving multiple funding sources that may be serving the same population. Do we have other questions? So I just want to mention again that our due date is May 1st at 5:00 p.m. All applications are through the SurveyMonkey Apply portal. We will be holding our second webinar next week. If you have specific questions about the documents that will be submitted or about the portal, and we'll do a walkthrough of it. And we are accepting extensions up to May 15th for those who would like to request. You do not have to request an extension. It's really at your discretion. If you want to request an extension, please email refugeeschoolimpact@phi.org. If you have any additional questions, you can also use that same email to reach us. And I'll put our FAQs in the chat again. We'll be updating the FAQs with questions we've received today or continue to receive. So please ensure that you're checking those to see any updates because we will be adding to them. Does anyone else have any other questions for us? Okay, Diana, can you please advance to the last slide, and we'll just leave that up for a few more minutes so you can record our contact information. Thank you so much, everyone, for joining. We hope it was helpful. We really look forward to reviewing your proposals, and we hope you'll apply. And looking forward to seeing you on the 25th. Thank you so much. Thank you. Take care, everyone.